Iowa families are strong, resourceful, and resilient. This past year, we have seen our strength in action, but we also know that some are disproportionately impacted by ongoing barriers and challenges in Iowa's economic, social, and cultural life. The Department of Human Rights provides pathways to self sufficient and productive lives for Iowans by working to reduce these barriers. We do this by helping Iowans access government, engage in their community, and increase their education, training, and wages, which in turn reduces their reliance on public assistance. We provide opportunities for youth leadership, and our energy assistance program improves the health and safety of low income homes. We also work to improve the criminal and juvenile justice system through research and data driven policy recommendations. This past year, the department has pivoted and elevated our work as the dire needs of vulnerable Iowans were exacerbated by the pandemic and other disasters. From providing rapid language access to time sensitive and critical information in 13 different languages for limited English speakers, to efficiently distributing federal resources to those most impacted yet least able to cope with the public health emergency caused by the pandemic. I am very proud of all of our work in helping our communities stay safe. I would also like to thank all of our department's board and commission members who volunteer their time to support the stability and well being of Iowa families. Together, we make Iowa a better place to live, work, and play.
In March of 2020, our agency, like everyone in the country, faced an uncertain time. The COVID 19 pandemic forced the closing of our schools, businesses, and many public transit routes, and created fear for our most vulnerable population. As a food pantry and regional public transit provider, we knew it was important to develop a program to assist those who needed food and encourage the statewide message for Iowans to stay home. With food, transit vehicles, and agency staff all available, we set out to coordinate our very first food delivery program.
Our food delivery program was made possible with funding through the Iowa Economic Development's Community Development Block Grant, the Delta Dental of Iowa Foundation Grant, local business donations, and CARES funding through the Iowa Department of Human Rights. In addition to our internal transit, Head Start, and weatherization staff supporting the program operations, the program's success can be attributed to partnerships with Northeast Iowa Area Agency on Aging and food pantries across our 7-county service area. With the helpful hands and compassionate hearts of many, we delivered over 88,486 pounds of food to the doorsteps of 1,474 households from mid-April 2020 through the first week of December 2020.
Household. Number one, it was extremely healthy because when I'm real busy, my mom has got degeneration of her eyes. She can't see and got to be to the doctor a lot of running for me. I got a lot of medical issues. So it's like when they can drop it off, it worked out great. I can schedule things, time things, and I don't have to worry about coming here if it's busy here with COVID and everything else. It's a great thing.
Hi, I'm Caleb, and I'm the Commission Chair for the Iowa Commission on Latino Affairs. Language access is so incredibly important, as we've learned throughout this global pandemic, when information is being released daily, hourly, and essentially by the minute, ensuring that all residents of the state of Iowa have access to all important information at the same time can help save lives. Thank you.
Unlike other spoken languages, American Sign Language, the most common form of sign language, is a deeply visual and conceptual language. It's important to know that many times those who are deaf and hard of hearing miss incidental information that can be essential to communication. Captioning is critical for those who have been born with or acquired hearing loss.
Over the past year, we have seen tens of thousands of Iowans not have access to emergency information in the middle of a pandemic. We have done some great out-of-the-box thinking to mitigate some of these issues this year. We have set up multilingual helplines in collaboration with 211 and IDPH. We've seen our ECBOs, or ethnic community-based nonprofits, come together and leverage existing resources and work together in ways that we had never seen before. We've seen other agencies reach across and help us with emergencies as they've arisen, and just have really gone above and beyond to be able to solve these problems. That level of collaboration and partnership has been really awe-inspiring over the past year.
In December of 2020, the Juvenile Justice Advisory Board submitted a report to the governor and to the legislature. We identified four areas or priorities that we wish to study and research and provide further recommendations on. As to racial justice, our goals were to end racial profiling, eliminate racial disparities to create an unbiased juvenile and adult justice system, eliminate disparities in excessive use of force and death in custody. In the mental health area, our goals were to identify those who need mental health care and provide appropriate services and placement to those in the juvenile and adult criminal justice systems, and provide safe treatment and living conditions for those with mental health needs in that same system. With regard to community-based corrections and alternatives to incarceration, our goals were to reduce entry into prison, reduce revocations to prison, increase the use of effective treatment courts, and document lessons learned from COVID-19 as to our systems. And finally, as to sex offenders, our goals were to examine the effectiveness of the special sentences, examine technical violations, examine the efficacy of sex offender residency requirements and restrictions, and provide support to both survivors and victims.
Hello, my name is Andrew Allen. I'm president and CEO of YSS based in Ames, and I'm also the statewide chair of Iowa's Juvenile Justice Advisory Council, the JJAC. That said, my most important title is alumnus. I'm both an alum of YSS programming and Iowa's juvenile justice system. Arrested for felony charges at age 10, I was introduced to juvenile justice early. Then, after being rearrested at nearly 18, instead of getting detention or jail or sentenced to the state training school at Eldora, I got treatment, and it worked. Today, I both lead the organization that saved my life, YSS, and chair Iowa's JJAC. Juvenile justice exists to help kids like me have a chance to change and become productive, contributing members of society, versus simply another statistic or expense line item sitting in prison. So what is the JJAC? Appointed by the governor, we represent juvenile justice experts and advocates from across the state who provide leadership in juvenile justice planning and system improvements. We oversee federal funding that's called Title II. We advocate for a fair juvenile justice system that treats kids equally regardless of race or gender. Many of our systems and programs we have in place for juvenile justice were designed for boys, so girls in the system struggle to get what they need. And in 2019, in Iowa, African American youth aged 10 to 17 were 6.5 times more likely to enter the juvenile justice system for a simple misdemeanor compared to white youth. We have obvious work to do. And that's why the JJAC's 3-year plan is ambitious, focused on prevention and early intervention, racial and gender equity, support and treatment for mental health and substance use disorders, and an intentional focus on youth transitioning out of the juvenile justice system into adulthood. So our agenda is ambitious, but it's good, and it's right, and it's smart. Effective juvenile justice saves money and sets youth who've made bad decisions up for success.
SIAC is a nonpartisan, policy advising organization comprised of 21 diverse youth from across the state of Iowa. Our council provides input to the state government regarding youth issues. We do this by creating and sharing legislative priorities to legislators at the Iowa State Capitol. Indeed, our council has advocated for a variety of youth issues in the past, including issues in youth education, youth health, youth human rights, and youth environmental concerns. Youth are the future leaders and policymakers in Iowa. Luckily, SIAC provides youth a platform to be heard. We allow youth to empower others, inspire action, and create change in the state of Iowa.